Hey, good afternoon, everyone. Dr. Thompson here. Trust you're well. I just wanted to reach out quickly and first off to comment on the recent shelter in place that's been ordered here in Tarrant County. Uh, I believe it's to begin at midnight tonight through April 2nd or next Thursday. For many of you, the service that we provide is essential in my view due to the pain that a lot of people are experiencing, and we recognize that. So because of this, I plan on being in the clinic for you through these 9 days during our regular office hours. And we're practicing all of the CDC recommended practices of social distancing and sanitary soaps, along with spacing out the appointments to follow, prevention of large groups. And we are, as usual, a phone call away for you to set your appointment. So just know that. As the situation continues to unfold around this coronavirus, I wanted to also take the chance to give you some tips that I believe will be very beneficial in moving forward and staying healthy by being proactive with your health. And we're going to beat this thing, I promise you. Currently, the reported worldwide cases, I believe, are at about 250,000, and the current death toll is around 10,000. And the entire U.S. is basically shut down with all the restaurants and bars and gyms and churches, and most businesses are closed for the time being. So first and foremost, I think that you should get outside and get some sun. That's my first tip. Get some sun, whatever you do. Please don't stay locked up inside of your house. That's probably the worst thing that you can do, in my estimation, to strengthen your body's defense mechanism right now. You need to get outside and get some fresh air and some sunshine. And now that we're in late March, most areas in North America, and especially North Texas, are starting to get warmer, get sunnier. And just getting sun on your skin right now is the biggest thing that you can do to support your body right now. The aspect of vitamin D production in your skin from the sun exposure is really just one aspect of how sunshine strengthens your innate healing system. There's other reasons too, such as how the sun improves your mood. It affects serotonin levels, balances your hormones. So whatever you do, please make an effort to get outside for something as simple as a daily walk in the sun. You need your skin exposed to get the majority of the benefits I'm talking about. Or get outside and do some gardening or other yard work, or even just lay out in the sun. If you have a deck, obviously without getting sunburned, but yeah, just lay out in the sun would be an awesome idea. And remember, getting outside doesn't mean that you have to be around a lot of people. You can still get outside and stay safe. And it really appears that you're not going to catch coronavirus by breathing outdoor air. The virus, from what I've read, only concentrates in indoor areas when you're around a lot of people. So being outdoors is safe. It's interesting also to note that what I've read recently, that the coronavirus has been it's been clustered between 30 to 50 degrees north latitude, if you look at a map. But areas further south of that have been largely unaffected. And in my opinion, and many other doctors' opinions too, the reason for this is because the sun has been stronger south of 30 degrees north latitude. So most populations south of there have a much stronger ability to fight off the infection than people further north that haven't really seen any significant sun in the last 6 months. Number two, I know you've heard a lot about immune supporting herbs and nutrients, etc. And while most of these nutrients won't kill the virus per se, what they can do is give you the ability to hopefully decrease your susceptibility, which can reduce your risk of catching the virus, or also reduce the severity and the duration of the sickness if you do contract it. So the point is, it certainly can't hurt to stock up on supplements that have proven through studies to benefit the strength or ability of your body to heal. And many people argue over how much benefit they'll have, but my position is that if they have any benefit at all in reducing your risk or reducing your severity and duration of this sickness, if it were to happen, then it's definitely worth taking them. And I personally am taking our Zymogen line specifically designed for this. And I can tell you that a high dose of vitamin C is worth taking as well. It can only help because there's no harm in taking reasonably large doses as well. Liposomal vitamin C probably is the most absorbed at a much higher rate than most vitamin Cs. and other nutrients that have proven to be antiviral and immune supporting, if you will, are quercetin, elderberry, zinc, garlic, echinacea, olive leaf, and astragalus as well. Number 3, I'm also recommending that you drink bone broth every day because it has a known effect on supporting your healing system. And I believe one of the best products is Kettle and Fire bone broth. They're one of the best you can get, and it's available online as well. Number 4, I've read from several infectious disease experts lately that people that are significantly overweight or obese are at much greater risk of severe health problems from this coronavirus than people that are at normal weight. So if there was ever a time to get down to a normal weight, it's now. It's probably going to be easier since all the restaurants and bars are closed at this point and there's no temptation to dine out. So you can, simply make healthy foods at home and lose fat easier that way. Number 5, smokers are also at a much higher risk of severe complications from this infection since it attacks the respiratory system. If there was ever a perfect time to just quit smoking cold turkey, it's now. Give it some thought if you're a smoker. You cannot smoke and be healthy, period. Number 6, another population at greater risk of severe complications from this virus are people with insulin resistance and type 2 diabetes. Again, it's time to take this seriously, and our wellness program directly addresses this. Now, lastly, it's very important for everybody to stay calm and not panic. No fear. The U.S. still has only reported around 33,400 cases and 400 deaths out of 330 million people as of a couple of days ago. So while the situation can get scary if this thing spreads far and wide, we really need to realize that a very tiny percentage of the population is actually infected right now. And as spring rolls in and the people get more sunshine, we'll be seeing a very broad strengthening of most people's ability to prevent this and to fight off the virus in the coming weeks. So we need to be realistic about this and not panic. Very important. Just stay safe and avoid any indoor places where there's a lot of people. Use common sense, no fear, no anxiety, because it only adds to your stress that directly affects your body's ability to function and stay well or getting well. And just remember, getting outside, getting more sun and fresh air, and now's the perfect time to focus on dropping weight. Fixing health problems like diabetes and stopping smoking is absolutely paramount. One other thing, please forward this to all of your friends and your family to spread these helpful tips to everyone. I would much appreciate that. We're going to get through this, I promise you, and I look forward to talking to you soon. Stay well.